Hello, my name is Lea Caplan, and I'll be sharing my research project entitled The Consequences of Elderly Women with Breast Cancer Not Getting Treatment. Now, breast cancer is one of the most prevalent cancers that targets mostly women, as 1 in 8 Canadian women are predicted to develop breast cancer within their lifetime. Age is also a risk factor for breast cancer, given that 83% of breast cancer cases are concentrated in female patients over the age of 50. Older women, age 65 and above, are more likely to refuse breast cancer treatments than younger women. Our research defines elderly women as being aged 80 years or above. Older adults are underrepresented in medical research, and few studies focus exclusively on aged women with breast cancer, which explains why a study is so needed. Our overall research question is to determine the consequences for relatively older women of foregoing breast cancer treatment. The purpose of our study is to explore the consequences of treatment rejection in older women with breast cancer in a Canadian context, and to examine the clinical differences between groups of treated and untreated patients. Our study was a quantitative retrospective case control study. The dataset originated from ACORN, or the Alberta Cancer Outcomes Research Network, and the study population was composed of women living in Alberta who were diagnosed with breast cancer from January 2002 to January 2015. And our dataset consisted of 2,542 patients, of which 336 declined to be treated for their breast cancer. Now, for a primary objective, we used Kaplan Meier survival curves to allow for the treated and untreated groups to be compared over time in comparison to the original cohort that was still alive. We also used Cox proportional hazard regressions to measure multiple demographic and clinical risk factors. The threshold that we used for statistical significance was 0.05. Now, looking at our data for our patients, the treated group had a mean age of 85.2 years, and the untreated group was significantly older with a mean age at diagnosis of breast cancer of 87.8 years. Now, Charlson Comorbidity Index scores, abbreviated as CCI scores, are scores of the patient's comorbidities or illnesses, and higher scores indicate having more severe chronic illnesses or numerous comorbidities, and these scores are often greater in the elderly and may impact their treatment decisions. There was a significant difference between groups in terms of comorbidity scores. We see here that the treated group had significantly less severe comorbidities than the untreated group. T and M stages are used to evaluate the size and extent of tumors, where greater stages indicate that the cancer is more severe and has spread across the body. A significant difference in cancer stages occurred between treated and untreated groups. Most treated patients were classified as either having a stage 1 or stage 2 score, whereas the untreated patients were mostly in a stage 2 score. So this is our Kaplan-Meier survival curve. If we look on the x-axis, you'll have the date since diagnosis, so time, and on the y-axis, you'll have your survival distribution, so how many people from the original cohort are still alive. Now, in blue, you will have the untreated patients, so patients who declined to be treated, and in red, you have the treated patients who got treatment for breast cancer. Looking here, you can see that just shy of 8.2 years, 75% of untreated patients had passed away, whereas here you'll see just shy of 14 years, you had nearly 50% of the treated cohort who had passed away, so a big difference there. Now, Cox proportional hazard regressions can show which factors are protective and which one lead to an increased risk of dying from cancer. There was a significant effect of treatment on the risk of dying from cancer, as patients that were treated were at 69% lower risk of dying from cancer as compared to the untreated patients. There was also a significant difference in risk due to age as observed in the various age group. Notably, in patients ages 91 to 95, they're at 49% higher risk of passing away from cancer as compared to the reference group of 81 to 85-year-olds. Finally, there's also a significant difference in risk of dying from cancer in terms of Charlson Comorbidity Index scores. Individuals with a high comorbidity score, so a score of 2 or greater, were at 34% higher risk of passing away from cancer compared to the reference group, which had no comorbidities or a score of 0. Now, breast cancer treatment is beneficial and seems to extend the lifespan in the elderly population with breast cancer. And this study has also shown that it's really important to create specialized approaches which target older women with high comorbidities, as they're a really unique population. Future research should be looking at how risk may vary according to treatment status and age, so really conducting those multivariate analyses would be a great step for the future. I'd like to thank my preceptor, Dr. Trafford Crump, for this amazing research opportunity, and Dr. Dr. Maylin Kwan for all of her support. Thank you so much.